Good afternoon. This is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. And this is number 153 live video. And all of these can be found either on Facebook or YouTube. And we try to put different headings on each one so that you can look them up. And today is going to be interesting, I think, for hopefully many of you. It's time to have some positive information and results concerning fibromyalgia. And we talk about so many different things that seem to be so negative, all the different symptoms and all the aches and pains, the problems that you have with insurance companies, Social Security, your friends, your family, all sorts of different things. And yet, excuse me, based upon history, okay, fibromyalgia has come along quite a ways. I mean, the journey has been long and arduous. As most of you know, it started, as I've mentioned to you numerous times, during biblical times, where it was mentioned in the Bible concerning all the aches and pains, and it seemed unable to sleep and sweating and so forth. And Shakespeare actually put the symptoms and the condition of fibromyalgia in some of his plays, Midsummer Night's Dream. But fibromyalgia has come along quite a ways in many respects, believe it or not, from those historically. You know, in the 1500s, 1592, it was really considered rheumatism. I didn't realize that the term rheumatism was that old, as a matter of fact, 1592. It's actually, fibromyalgia has gone by so many different names, and I've covered a number of these. It's fibricula in the 1750s, neurasthenia in the 1800s, 1895, so forth. And during that period of time, doctors were doing a lot of experimental surgeries on a lot of women, and to apparently treat this unknown, undiagnosed condition. From the Civil War until World War II, they gave it the name from a military surgeon during the Civil War, DaCosta's syndrome in itself. In 1990 was the first time the American College of Rheumatology wrote a specific paper naming fibromyalgia in itself. And so that in itself, just historically, going all the way from biblical times till 1990, is quite a trek. And again, as I mentioned to you, fibromyalgia has been under so many different names. In 2013, the National Institute of Health actually finally came out and said, listen, this is not in your head. This is an actual disease that is prevalent, and I'll read to you exactly what they said. According to this research, fibromyalgia has a pathology and is not psychosomatic. So those who suffer from this syndrome can now rest assured. Heard that. So the National Institute of Health in 2013 actually named this as a disease itself. Now, they did call it a syndrome, okay? And I always said that syndromes mean, like fatigue syndrome, that means that the insurance company have a reason not to cover this, okay? But believe it or not, Mayo Clinic actually had some doctors write a book called Mayo Clinic Guide to Fibromyalgia, matter of fact, from an MD and a PhD. And I took numerous notes on this information. And it really is, they started with saying it's a condition that doesn't have a cure. Well, I find that research-wise, and the doctors that I have worked with in research, have a pretty good idea what is causing this. You may have all sorts of different information, and that's the one thing about this information now. There's so many programs that are out there for fibromyalgia, and many of them are pretty good. Many of them are based upon the the dietary anti-inflammatory information. Some of them I think are not so good, especially if they're including pharmaceuticals that I've mentioned to you before, and doctors agree to it. All pharmaceuticals have side effects. Hi, Brenda. Hi. Having so many physical problems. Okay. I need some kind of advice. Okay. One thing about one of the individuals that has just introduced herself is she's having many problems. And as I mentioned to you before, fibromyalgia is not by itself the disease. Since 1990, working with fibromyalgia patients, I have not met one fibromyalgia patient that just has fibromyalgia. So every fibromyalgia patient needs to find out all of the other conditions that are mimicking or making fibromyalgia worse. That's very, very important. And I've covered this subject before. I believe there's 13 different diseases, conditions that are very, very similar to fibromyalgia. That's, again, is why fibromyalgia is so difficult to diagnose. If you start talking about headaches initially, all of a sudden it's a neurological thing they start looking at. If you start talking about aches and pains in your joints, that goes in another direction. If it's stomach, irritable bowel, something like this, that goes in another direction. Most doctors don't look at it in a much wider screen. So it's important for each and every fibromyalgia patient to, again, find out all of your other conditions. I just had a fibromyalgia patient come in just the other day and talking about so many different conditions that she has. So that will make fibromyalgia, all of the symptoms of fibromyalgia, worse. And so you have to understand that. But understanding all the different conditions or diseases and so forth that you have are extremely important so that you work on a much wider spectrum, so to speak. There have been some successes, many of them in our clinic, because we work different way. We condition out the symptoms. That's very important. But again, secondary conditions, especially those like rheumatoid arthritis, hypothyroidism, so forth and so on, hypoglycemia, we may not be able to help you on those with our program. You need another secondary physician to help work with you on those. And so that's extremely important that you understand. But the most important thing out of all of this is make sure you're diagnosed properly on all of your conditions, okay? That's extremely important. In the history of fibromyalgia, it has also come to pass that now it's understanding that fibromyalgia is triggered by some physical, emotional, or chemical trauma. We have found that fibromyalgia, because it is a genetic thing, handed down from great-grandparents, so forth and so on, that you may have a variety of different levels of fibromyalgia. Many people, I talk to, they say, well, I've been tired, seems like all my life, or I've been achy and sore, and the doctors, as I'm developing and growing, I go to a doctor and he'd say, well, it's growing pains. Well, that's a low level of fibromyalgia in many respects. And oftentimes later on in life, due to some physical, emotional, or chemical trauma, auto accidents, death in the family, molds and spores, so forth and so on, that's when it really is triggered to a much higher level. And that's why fibromyalgia has so many different levels of symptomatology or symptoms and pain in itself. Some of the different treatments that have been suggested, cognitive behavioral therapy, that's one of them. Although cognitive behavioral therapy, even with Mayo Clinic, says it's helping the symptoms in many respects, but not, again, the cause or the condition. Positive mental attitude, apparently a positive mental attitude, along with the cognitive behavioral therapy, works with the central nervous system to keep you calm, reduces stress. There's been a lot of research and studies being done. As a matter of fact, the Mayo Clinic book mentions a lot of studies. They don't go into who's doing the studies, but I do know there's a lot of studies, and some of them are research, and they suggest a lot of a variety of different things to help fibromyalgia patients. Physical activity, that's and again, this level of physical activity can be Uh, Something like just getting out of bed or trying to walk. Start very, very slowly. Any kind of activities, especially physical activities, stimulates endorphins and enkephalins, which are natural, really, if you want to look at it, anti-inflammatories, and they help reduce some of the pain. Proper sleep is very, very important. I can't tell you how many fibromyalgia patients come in and they have sleep deprivation, which obviously causes a lot of fatigue and also other health problems. So you have to force yourself to get proper sleep. And I've talked about sleep and the levels of sleep and the hours of sleep that you should have. It's not so much the hours of sleep. You know, they say you need to have about 7-8 hours of good sleep. The type of sleep that we're talking about is deep REM sleep, and that's on 90-minute cycles. So that would be, in effect, 90 minutes, 3 hours, 4.5 hours, 6 hours, 7.5 hours. If you can do that, that's much better than just trying to force yourself and trying to sleep. Of course, there's a lot of fibromyalgia patients that once they get in bed, they can't get out of bed, and they bypass the deep REM sleep in itself, and they feel a lot worse if they get up. What happens is if you wake up in the middle of one of these REMs, so to speak, you're going to be agitated and irritated. So instead of the 4.5 or 6 hours, let's say you get up in 5 hours, you're going to be agitated and irritated more during the week. But again, sleep is something for you to look at as far as a possible answer in itself. Social activities. Another thing, social activities, especially with friends, family, so forth and so on, it's very, very important. They even suggest like a Saturday night out, so to speak, where every Saturday, or well, you could pick whatever day you want, to go out with some friends or whatever else and just try to enjoy yourself, okay? Meditation is another thing that is suggested. Yoga and a variety of different forms of meditation. Proper diet. I can't tell you how many times I mentioned to you. We strongly suggest an anti-inflammatory diet, a restricted hypoglycemic diet. I know this is a broken record for many of you. Take sugar, gluten, trans fatty acids, and dairy out of your diet. They're all considered inflammatory for the general public. Does that mean that dairy is bad for you? It may not be, okay? But if you take it out of your diet for 2 weeks, then add that product, that dairy, or whatever else, and add it and see what kind of reaction that you have. If you have a bad reaction, there's a good chance that that is an inflammatory reaction that your body's going through, that you need to stay off of that product or that item, whatever it might be. Again, sugar, gluten, trans fatty acids, and dairy, and all of the products involved with that. They suggest balance exercises, any kind of activity. You know, balance exercises can be just getting up out of a chair and trying to stand upright in itself. I'm being positive. Okay, Brenda, let me just read this. You're in a very positive state of mind in fighting this. Don't surrender. Don't give up. Okay? Try some of the things that I'm suggesting. Again, this is research and studies that are trying to help fibromyalgia patients. Years ago, in Canada, and this is not a knock against physical therapists, but a Canadian physical therapist did a study on fibromyalgia, and they suggested really a strong level of exercise. The only thing I can say is that nothing is perfect for everybody. For those people maybe in fibromyalgia that are not severe, maybe exercise is good for them. For those people that have moderate to severe cases, exercise of an extreme case is not good for you. I remember some of the patients would come in and they would try some exercises from various other doctors and so forth, and then I wouldn't see them for a couple of weeks because they were so sick and sore and achy. What I'm trying to get across is that there are some different things I want you to try that they didn't have any answers for. The answers that they had years ago, were really severe. I mean, we're talking about the removal of sex organs and appendices, multiple appendix surgeries. How can you have but doctors were trying a variety of different things, or psychotic things, or psychiatric treatments, so forth and so on. You're not crazy, okay? You do have a condition. It's National Institute of Health mentioned it. American College of Rheumatology knows about it. We believe that it's genetic. It can be controlled, and the condition can be controlled to the point where you can live a normal life if you go through our protocol in itself. And that's the most important thing. I know I've seen it work on so many different people. It can help some of the secondary conditions that you're having, but it can't reverse those. You can't reverse rheumatoid arthritis, okay? You can control diabetes. You can control a lot of different conditions. Osteoarthritis, again, you can't reverse it once you get it, but you can conditionally control a lot of the different secondary conditions that you have, but you can't reverse many of these. I mean, once you get certain conditions, you can't do much about it other than getting them under control. And if you get those under control with the fibromyalgia, it'll make a world of difference. It really can. There are answers out there, but every person is different. And you have to understand what your other secondary conditions are, okay? And how they are adversely affecting your fibromyalgia. And that's, I think, some of the more important things that we get. It's gone from biblical times where they knew nothing about it other than talk about it in Shakespearean times, all the way through history, including, as I mentioned to you, here's another thing. The scientists were, if you were in Germany studying this fibricula, or if you were in, say, in other parts of Europe, let's say Sweden or whatever, you may not understand. You may not be able to communicate. Today, you just pick up phones and talk to each other, or through the internet and so forth and so on. So there are a lot of independent studies going on by different doctors to try to figure out what this condition was, because it didn't fit with the medical diagnosis, of course, because there was, still today, there is no objective test to validate. Somebody has said, what about these blood tests and so forth and so on? I think about 2 months ago, I did a study on that to find out if there was really true diagnostic objective tests, and there are none that are valid as of this point right now. And so that makes it very difficult for, again, MDs, DOs, anybody in medical diagnostic society to diagnose fibromyalgia and accept it, because it's not part of their training. But more and more, like I say, Mayo Clinic accepts fibromyalgia. There's so many different things that are going on now. So use your computers to find out some of the different things. Use mine. Find out what we do. I've talked about so many different times. Look up on my website and so forth and see what we do. I've been doing it since 1990. And since 2000, Dr. St. Aman's protocol, which I find to be very, very helpful for those patients that fall into the norm of our treatment. But again, we're not treating these other secondary conditions that cannot be reversed. But I've seen fibromyalgia reversed by many of our patients to live what we would call a normal, healthy life, so they can plan on something tomorrow and know that they can do it. Well, I've given you 20 minutes of time here. I apologize in that respect. But again, think of it in positive terms. And if you're already positive, great. Just like Brenda here, she says, I'm not going to let this defeat me. That's great. Brenda, if you want to talk to me or whatever else, you want to send emails, again, please feel free to. My email address is dcken, the number 2000, 2000 at cs.com. Again, D as in dog, C as in cat, Ken, K-E-N, 2000 at cs.com. I'm not going to try and sell you something. I'm going to give you answers, maybe some of your questions, and hopefully assuage your feelings toward certain things maybe that you need to try in itself. Hey, thank you so very, very much, everybody. I thought I'd give you a little bit of positives in this. And Brenda, I can't thank you enough for joining us. There's certain things, sometimes it's the smallest little thing that will make a huge difference in your life, especially when you're talking about fibromyalgia. Something you have missed, maybe something that we need to discuss and talk over. Anyway, take care. Best wishes to each and every one of you. Have a wonderful week. And Brenda, thank you very much for participating. Really appreciate it. And all of you that have come on with questions, thank you so very, very much. Again, next Monday at 12:30 p.m. Arizona time, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. This is Dr. Ken Muich. Invite your family, friends, doctors, so forth and so on in the discussion. I have hopefully another subject that will be interesting for you. So many times, many of the patients give me subjects to talk about that make it a lot easier for me. So if you have something, let me know. Thank you. Thank you very, very much. Take care, everybody, and have a wonderful week. Be safe. I'll see you next week.